So maybe if you can, perfect, our recording is going. And well, welcome everyone. I'm so glad to have the time that we can share together today. This is our president panel. My name is Mena Mirhom. I am the president of New York County Psychiatric Society, and we're very excited to be able to host this event, in particular on a very special March Madness time, coming off of spectacular women's championship game yesterday, which was, I think, the highest viewed game, men's or women's, in many, many years. It was such an incredible game. And then tonight, some game will happen and it'll be kind of okay, no big deal. But I think the big game was last night. And I'm excited to be able to have real experts, I think, in this field of sports mental health for us sort of learn from. And before I introduce them, just a little bit of housekeeping piece, because we're in the Zoom world. I know it's been many, many years of Zoom life, but if we can just make sure we try to have our audio muted. And if you have any questions, if you want to share any comment, please share that in the chat. We'll definitely make sure there's some Q&A time. We want to make this interactive for you to get to know the panelists as well. If you're able to be on camera, that will be wonderful. If not, no big deal. And we'll also be recording this session, and we will share it afterwards as well. So welcome to those who are med students, residents, attendings. Really happy to have you all. So I'm just going to go ahead and introduce our panelists, and we've got some questions that we'll share together, and then we'll get into some nice discussion. All right. Hopefully everyone is having a good eclipse day and everything was okay with our visuals for today. So the first panelist I want to introduce, Dr. Candice Williams. I'm so happy that she can be with us. She is the director of Mind Health and Wellness for the Boston Celtics. And I would say partially she's responsible for the Celtics having the best record in the East right now. Jason Tatum looks more composed every day. I'm like, oh, Candice must be doing something awesome with him. So welcome, Dr. Williams. Thank you for being here with us. Our second panelist, Dr. Brook. Choulet is the president of the American Board of Sports and Performance Psychiatry. She's the former psychiatrist for the Phoenix Suns, has been working with athletes both on the NBA side and the NBA PA, or the Players Association side, for several years now. And we're very excited to have her as well. Welcome, Brooke. Thank you so much for joining us. And then last but not least, we're just being chivalrous and going ladies first, but Dr. Alex Reed is the team psychologist for the Denver Nuggets, defending champions. Or we were almost going to put, Alex, a picture of you with the championship and the champagne goggles. That's one of my favorites that I saw there on social media. That was awesome. And also the team psychologist for the MLS, the local soccer team. So not just dabbling in keeping busy with basketball and soccer, just covering all kinds of sports across the board. So thanks for helping the Nuggets win the championship, and try to help them a little less this year so the Knicks can have a better shot. All right, just welcome and thank you for having us. So just to kick it off, the first question that I just wanted to ask the panel is, can you just share with us a little bit about kind of how you developed this interest of sports mental health? This may not always be something that folks learned about in med school or in graduate school. And how did you sort of come across this to be a personal area of interest for you? And then a little bit about your journey to be in the position that you're in now, to work directly with a sports team, to work directly with athletes. And we'll just go, maybe with each panelist. So if we can start with Dr. Williams, please share with us a little bit.
Thank you all for having me. Excited to kind of share some nuggets, as well as answer some questions in reference to this topic of mental health in sports. And so I always tell people that mental health and working in sports chose me. I didn't choose it. And so I am a mental health therapist, a licensed professional therapist by trade. I got my master's degree in clinical counseling from Sam Houston State University, and then decided to pursue my PhD. At that time of pursuing my PhD, CTE had just come out as a new discovery in terms of brain trauma in reference to NFL players and the implications of that trauma as it relates to their mental health. And so my dissertation topic was athlete mental health, student athlete mental health particularly. And I spent a lot of time researching that topic in terms of help-seeking behaviors of those athletes, and got to also work with student athletes on the academic side as an academic advisor at the university. I received my master's and PhD. I guess my sporting claim to fame in terms of mental health is my dissertation. I wrote a dissertation on female student athletes who experienced a pregnancy, competing at a Division I and Division II university. It got recognition from the NCAA. I was able to receive a grant, and my focus was on how does pregnancy impact their athletic performance? Two, how does their athletic performance impact their mothering? And then from there, in 2012 was when I started my research and my doc program. I graduated in 2017, but in between that time, I got a job at the NFLPA, which is the union for the NFL. They were looking for someone to particularly handle crises that were mental health related of former NFL players. And they wanted someone who had experience in crisis intervention and trauma, which my training, as I was getting my PhD, I was also a therapist working in trauma, particularly trauma-focused cognitive behavioral therapy. So I had experience working in that space. And from 2014 to 2017, no, 2014 to 2019, actually, I worked at the NFLPA triaging mental health related calls, getting players to amazing, wonderful, vetted professionals in the community across the globe, vetting those places, vetting the treatment facilities. Contacting people like you all in terms of, are people available? Do they have knowledge working with diverse populations, if not athletes? Building mental health services for former players, because at that time in 2013, there was a collective bargaining agreement between the NFL and NFLPA that said there are no transitional services for NFL players as they leave the league. So I came in 2014, which is the year after Junior Seau had taken his life following his retirement. So did that for 5 years and then decided I wanted to get ahead of the curve when working with football players related to their mental health. And so was able to secure a position at the Ohio State University, working with the football team there and worked there for 3 years, providing mental health therapy, sports performance related interventions, education to coaches. And there was one particular athlete who has publicly come out and stated the help of the mental health providers that were there to make sure that he was alive and healthy. He was on Good Morning America. He's been to the White House advocating for mental health resources for student athletes. You can Google that. His name is Harry Miller. And that was pretty much a pivotal moment in my career as a mental health professional. And then transitioned into working at the Celtics by applying for a position and desiring to work at this level with professional athletes. And one of the things that really solidified the connection here with the Celtics was that the individuals that I had worked with at Ohio State, at the NFLPA, the interviews that I had gone on for other teams, those individuals talked. And so they asked those folks at Ohio State, they asked those people at other sports teams that I had applied for that I didn't secure that position. What is it about Candice outside of meeting me in person, which got me here. And so I'm in my second season with the Celtics, and I travel with the team. As you can tell, I'm in a hotel room. I am at practice. I am at every game. I am accessible to them in the sense that I'm a traveling clinician. And I, am enjoying the job experience and the challenges that arise every day to help me be a more skilled and competent clinician in the sports space. So excited to share more and to answer any questions that you all may have.
Thank you so much for that, Candice. Really appreciate the kind of seeing as well. I think from the panelists, there are some who maybe picked up an interest a little bit later, but to hear this has sort of been an interest of your dissertation and since then, that's pretty incredible. Appreciate that. Let's go to Dr. Brook. Can you share a little bit with us of your journey from kind of how this became an interest and then even developing something that has never been there before, like an actual accreditation process? Please share with us a bit there.
Great. So back when I did residency and then child and adolescent psychiatry fellowship, I knew that I really wanted to be in private practice, and I knew I really wanted to provide concierge psychiatric care. So I knew that my niche were what I thought it would be. And then, like Candice had said, it kind of fell into my lap, and the sports world came to me initially. So I had started my practice a year before finishing fellowship. started hiring people. One of the people I hired was Dr. Jamie Shelton, who's a sport and performance psychologist. She was contracted with the team, with the Suns and the Mercury at the time. And this was right around the time where COVID was happening and the bubble was ending and people were slowly returning back to in person. And so I was asked to provide concierge psychiatric care to players that needed it. And that's how I ended up getting really deeply integrated in the sports world. I absolutely loved it. I really loved the complexity. And I think the complexity of treating athletes in a team environment is what really led me to establishing a network with several other sports psychiatrists across the country. And we were all talking like, residency and fellowship does not prepare you to work with athletes. Why isn't there an accrediting board like there is for sport and performance psychology or like there is for addiction psychiatry? And so the seven of us came together and formed the American Board of Sports and Performance Psychiatry at the end of last year. And we are having so much fun with it, being able to really set a standard of education and a standard of excellence when treating athletes, and really making sure people have the adequate education and training, not only past being a board certified psychiatrist, but actually working in some of these environments, because I'm sure the other panelists really understand that it's not just treating the athlete, there's all of these other people involved, and the ethics and the professionalism, it has to be fully understood and recognized to really be executed appropriately and effectively. So that's how I found my journey into sports psychiatry. And then now I'm a listed provider on the NBPA, and I really enjoy just being able to provide care to more athletes in different states. So I'm licensed in Arizona and California.
Love that. Thank you so much, Brooke. And that was one of the most sort of enlightening things that I'm learning from you, just kind of because it does feel like the psychiatry world is a bit behind the psychology world, and we're fortunate to sort of have both perspectives on the panel today, to be able to see, okay, we got to really catch up, because for someone to really get good, great care, we want to give as much support possible around them, right? So thank you for the hard work around building that sort of those pillars of excellence around what care looks like. So appreciate that. Dr. Alex, can you share with us a little bit about your journey as well?
Oh, glad to. And yeah, thanks so much for the opportunity to be here. And, great to see you, Candice, and great to see you, Brooke, as well. So, yeah, so I have, it's strange because I've primarily worked in residency programs throughout my career. So I've really, for the past 22 years, I've worked in family medicine residency programs. I've worked in psychiatry residency programs and also OBGYN. And when I moved to Denver about 9 years ago, one of the family docs that I did some research with in our department, he approached me and he said, hey, Alex, I know you've done some sports stuff. And I taught a class in sports psychology at Wichita State University, and had worked with athletes at Boise State University as part of a residency program there, where we had a sports medicine fellowship in our program. So I'd, done some stuff here and there working with athletes. And then, this family doc that I work with, Dr. Morteza Cody, he's also the team physician for the Nuggets and has been the physician for about 10 years. And so he approached me and said, hey, Alex, the Nuggets are interested in having someone come talk to them about sleep. Would you be interested? And I was like, oh, of course I would. Absolutely. And so they invited me down, they vetted me, saw my background. And so then, they said, okay, we'd love to have you come do a talk. So we'll have you talk with the players and coaches. You've got 5 minutes. Can you do a talk in 5 minutes? And coming from an academic setting, I was like, oh, well, of course I can. So I did that. And from that really, some players approached me after that talk, and then they asked, would you be interested in meeting with players if they were interested? And so from there, I started to see a few players, and really that was where the NBA Mind Health program was promoting mental health for the NBA athletes, and really starting to push some different recommendations. And so then in 2018, that's when they asked if I would be their team psychologist. And so I do that part-time. And so that's been a lot of fun, very surreal at times. And especially winning the championship, the first one for Denver. So that was a big deal. And, got to be in a parade. I've, generally been in a parade where, maybe it's like my kids are on a bicycle and I'm behind them making sure they don't fall. So this is a little different, but, and then, with that work, I then, this past year started to become, I was hired to be the team psychologist for the Colorado Rapids. So our local MLS team, which has been really interesting in terms of just, seeing the dynamics of different teams and organizations, some similarities, some differences, especially just across sports as well. And, and one last thing I'll just say though, is that it's been interesting as well in that I've really come to appreciate how much like I view residents and physicians and psychologists, like we are sort of the elite athletes of our own professions, and the residents are really sort of the rookies, if you will. That's a anywhere from a 3 to 7 or many year rookie program. So, but there really are quite a few overlaps as well. But that's my story.
Love that, Alex. And I might just put elite athlete on my card going forward. I'm gonna say like he said that I kind of am. So, I'm gonna just go with that.
Yeah.
Right?
Yeah. I mean, what they make, when they question that, you can send them to me, and I don't know if that'll work well for you though, but
But actually one of the reasons we were really excited about this panel is, in addition to obviously there's great experience that you all have had directly with the NBA, but really seeing the NFL, the MLS, the NBA, like really professional on a collegiate level as well. There has been sort of a growing movement over the past couple of years, and we wanted to really acknowledge the work of someone like Dr. Kenza Gunter, Dr. William Parham on the NBA PA side, and many others who have sort of been paving the way. And as you all have mentioned that, can you speak to a little bit about how this wave of, and Candice, you alluded to this a little bit in the beginning, of how when an athlete kind of comes out with a piece, we know that when Kevin Love was outspoken about it, or DeMar DeRozan, when there were these pieces in the Players Tribune, and when there was really great summit actually that was hosted by the NBA PA, which we met there was this discussion around how the breakdown of that stigma internally in the sports world also translates or has an impact on the patients outside of the sports world. So can you speak to a little bit of that dynamic of, as stigma is decreasing, thankfully, through the work of advocacy from athletes, how have you seen that play out in terms of the star power, the impact of an athlete openly sharing their mental health, and how do you navigate that and sort of the impact and the role in the decrease of stigma overall? And whoever wants to start there first, we're going to open it up a little bit more.
Well, I'll start and brag for Candice for a minute, but she's kind of who I use as a great example of someone that's really been able to decrease the stigma on a team. And I'm sure she'll give lots more information, but just know that I do use you as an example when I talk to people about what a team environment can look like. Every, in the training room, usually there's a TV that has lists of, physical training, strength and conditioning, time for PT rehab. So why isn't there more just normalcy in just putting up, hey, meeting with the team psychologist? I think until we can get to that point, it'll be very hard to continue to drive that mental health is just as important as physical health when there's still that kind of a stigma. So I think that the work that each person's doing in their respective team and respective environment and association that they're working with has a huge role to play in driving that advancement. And I also think that the PA side of things in each league, the NFL PA, the NBPA, they're really trying to make services more accessible to the athletes and making them feel like they could trust the clinician and have a good dynamic in that relationship. Because I think oftentimes, no matter in sports or not, past bad experiences that people have had with a mental health provider can sometimes disrupt their motivation to get help in the future. So I think it's all of our jobs to continue to show what a trusting relationship could look like and how it can help that person.
And I think to add to Brook's points, and I thank you so much for your kind words. I mean, I'm in my second season. The first season I came in, I did not know what to expect, but I knew that I had experience being successful at the collegiate level over the past 3 years, working with the Ohio State football team and with the men's basketball team in reference to, how to decrease stigma within the professional space as a mental health provider who is coming in where some people might have some knowledge in reference to what this person does. Some people may have had, to Brook's point, previous experiences that weren't so pleasant. And so a couple of things that I knew coming into this space was, one, building trust. Two, also education. And education is going to look like very differently in different spaces, depending on what the autonomy you have in this role at different teams, what the needs are as well. And that it doesn't have to be as like typical or what you assume it to be in terms of educating people or how you can be impactful, right? I think being a mental health provider and having an office that has a couch and clients coming to you is typically the traditional way in which we treat clients, whether it be virtual in the virtual space or if we have a physical space. Whereas I shared with you, I'm in a lot of different spaces, right? And I'm constantly having to be mindful of, outside of observing our coaches and players, where might be opportunities where I could be impactful in giving some tips or just being able to hold space. If I have a private space, or even if I don't, but I'm able to be impactful or to be a resource in that moment while maintaining confidentiality. There's so many different things that go through my head in my position as a mental health provider, while also giving off this energy and uh, uh, providing an opportunity for people to see me as a real person and someone that they can come to and confide in. And so it definitely has challenged me from the traditional way that I was trained as a mental health provider to now be in a space where you have to balance a lot of different things, and assuming that everyone is not going to be accepting of either the role or the position. And how can I, pretty much like a politician, not convinced that, you need to focus on your mental health, but when you decide to, I'll be here and I'll be available for whatever that thing is that you need. And so education and intervention look different. And I had shared this with the Mind Health group last season, and I know Alex uses it. We have as simple as postcards. When we're on the road, we have pre-stamped postcards of the city that we're in. We put them out at lunch and at breakfast, and we encourage the players and the coaches to write a handwritten message to their loved ones, whether it be your grandmother, your cousin, your own children, and your wife or significant other. And everybody on our staff takes the time, 5 minutes, to be able to sit, whether they have their food or they're having conversation, to see these young men sitting and writing a postcard versus sending a text or calling people, and being excited about that and saying, oh, we have postcards today. That is one, opportunity that they could practice mindfulness. They can really be intentional and take a pause and really focus and put their attention on one particular task. And most of us don't think too much about a postcard, right? Pre-game, I meet with players pregame, and and the way that we have kind of worked through that stigma around mental health is your brain is a muscle no different than any other muscle in your body. So how can we train you from your body from the neck up and not just the neck down? Understanding that your brain is a muscle, and how can you break a mental sweat, whether that be reading a book, doing something that is going to really help you develop yourself in terms of skill acquisition, or learning new information that isn't specific to basketball. And then also too, what is anchoring them? So being able to help them holistically understand that your mental health is no different than your physical health. We measure the velocity to which they jump, how much they lift, and their strength. And it's also saying to them, let's look at, in terms of measuring or or encouraging you to do some things within to flex that mental muscle that aren't so burdensome sometimes, of like spending time with your family, doing things that aren't, or learning new hobbies that aren't physical in nature that will compromise your ability to perform on the court. And also to just encouraging them to be aware. And so a lot of the things that I do, I have to be creative, I have to be innovative, and I have to be mindful of how I approach the conversation around mental health. But that necessarily won't start unless I, as a person and my personality and building connection, as we know, in terms of that therapeutic alliance and relationship, if I don't have that first, I may not be able to connect with that player to help them in whatever need is necessary. But, it could be a 5-minute conversation on the court. It could be in the elevator, giving them some affirmation and encouragement. And so it runs the gamut. But it has really challenged me to get outside of my therapist box sometimes and into my coaching uniform at times too. So.
Love that. I know Alex maybe will share as well, but I just wanted to comment. You may want to trademark this working up a mental sweat. This is like there's some, I was just taking notes. Man, these are some really cool ways to rethink even the perspective around mental health. It's not always what we sort of traditionally thought, both as a provider as well as somebody receiving it. They may have this perception of, if I'm going to get anything, it's going to be laying down on a couch. So appreciate the creativity that goes into that as well.
Yeah, I have to tip my hat to Candice. Yeah, that the postcard intervention has been outstanding, and it's been so much fun to see how that has worked out. And I think, and what I've sort of learned, and where I've seen this change, stigma change and so forth. I know for me, when I came into this, I've worked in integrated primary care for a while now, and so that, for me, that really helped set me up, because I've always viewed myself in the working in family medicine and OBGYN as very much an anthropologist, and I'm living in another culture. And the NBA and each team is its own culture. And depending on what the coach and assistant coaches bring and the GM and so forth, like that really sort of lays out like what, for example, where does mental health fit within the picture as well. And there's such variation among all the teams and different sports as well. And in that, I've really sort of focused in terms of what can I do to help reduce stigma. It is that tool that we all have in this business, which is building relationships with people and getting to know them, and providing empathy and understanding, because these are like it's a really tough gig, and the way I've sort of thought about what each NBA team is like, and I'd be curious, Candice, so what you think about this too, and Brook. It's almost like a rural town where it's this very isolated group, that they are around each other all the time, and more so than they are their own families. And with that, there's all different dynamics that play out. How does communication work? The very things that we see in families and in the folks that we work with, and in that, it's finding these different opportunities to connect and do little interventions and build relationships, so that way people don't, most of their, if they've had a mental health experience, it's only from their own personal experiences or maybe something they've seen on TV. And in a sense, we get to be, I think, these ambassadors for what a mental health professional can be and how can we work in these environments. And they also don't know, coaches, like they don't know what we do. They don't know the skill set that we bring. And so that makes it both challenging, but also kind of fun to see, okay, what are these small things that I can do? And that has been a big also piece for me in terms of, working on stigma and helping to show how this work can be useful, is going, with baby steps. I mean, really small things that over time can build to bigger opportunities.
And if I could add to what Alex said, it to his point, and I travel, I'd say 90 to 95% of the time with the team. And it is, you're around people all of the time. And there may be, depending on different, teams and how they're structured, this expectation that, you're observing, you are a resource, you're available. Even though we do a really good job of setting healthy boundaries, there is this, um, uh there's also the thought of like if someone is in need of something or is in a crisis that you are available within reason, and then two, you are a part of that culture, right? And so then it is also managing mental fatigue, being able to, like I said, set healthy boundaries, not just from a physical standpoint, but when we look at like loneliness in terms of how it affects athletes within the NBA. It affects coaches and training staff alike, and even, the clinician at times. And so there are a lot of things to think of, and being mindful that it also is still a business at the end of the day as well. And depending on how embedded you are within the team, you're also seen as a potential colleague to these young men. And so it's definitely been a opportunity of growth for me as a clinician, being in this space to really learn leadership, as well as being able to, again, observe and just to Alex's point, it's an opportunity to look at, okay, this is how I can be impactful. This is how I can provide additional education, and not taking things personally because the way that the business is and the way that it is set up, it's, you are a clinician embedded in an employment, space in terms of these are young men who are more than just athletes, but you may have um, a healthy culture in the sense of a team, but then there's also the business aspect of it that has to be considered um, too.
Absolutely. I think Stephen had a question. I'll ask you to unmute, but one quick thing that we'll hopefully get to as well is how you navigate all these potential different interests, right? Both between, I know Brooke and I have talked about this in the past as well, but I just want to give some space for Stephen. If you have a question, feel free.
Yeah, thank you. It's been a pleasure to hear from the panel just about these different aspects of sports psychology, psychiatry. So after 9/11, I was in New York and I worked with a lot of first responders. And I worked with somebody named Craig Katz. And what we called it was really psychiatry on the run, meaning that the way we did, we would have lunch with them, we'd sit, we'd have them chat. I have some experience in group dynamics and stuff like that. And that's kind of the model that we used, not so much the 50-minute session. Then I go up about 20 years later, and I was speaking to a psychiatrist that I know who is, I guess, the sports psychiatrist for the Cincinnati Bengals. And what he was saying is that he will work with athletes just in the training rooms, particularly athletes, for instance, who have been injured. They're really worried. They're going to lose their position, or they're going to lose their job, or they're going to be cut, and what's going. So I wanted to, I guess, ask the panel about the type of therapy that they do. It's sort of an amalgam of these kinds of things, or is it 50-minute sessions? What happens?
I think one thing that's specific just about sports psychiatry and psychology and is that when you're working in these team environments, you have to be adaptable. I remember when I was with the Sons of Mercury, like one time we literally met in a closet that had 2 chairs. Another time the massage room was the only place I was available, and we dragged 2 desk chairs in there. So I think it's just really unique to have to be adaptable. And I think as Candice and Alex mentioned, that a lot of these guys have really, really just normal human problems. And so I've found myself that what may start as a performance concern or something that's on court related, right? Because that seems easier to approach help for than some of the other stuff. really, I just always go back to CBT fundamentals of like let's identify, first of all, that this is a cognitive distortion. What kind of cognitive distortion is this? What subsequent thoughts, feelings, and behaviors does that lead to? And really, like, really targeting cognitive distortions. So I find that the actual types of therapy might not be all that different from just the normal person you would see in your office. I think just having a deep understanding of the stressors and environment is challenging. And well, like you said, at the Cincinnati Bengals, being able to have conversations in the rehab room or the training room would be awesome. But that also takes a staff that's fully able to understand the benefits of that. And I think that in every team, it's a different environment and a different culture. And so always staying adaptable and flexible to the people that are around you, because it's almost like you have 6 different patients. You have the athlete, you have health and performance staff, you have GM, you have owner, like there's all these different players. And so at the end of the day, figuring out what's best for you and your patient, and then being able to adapt to the environment that you're given becomes part of the challenge.
Mhm. And I would say too, depend on how you are embedded within the team. I'm full time, and so to Brooke's point, different players have different needs. We do have a clinical psychologist, Dr. Stephanie Pinda-Amaker, who was on staff part-time before I became full-time, and she's been there for 9 years, and so there's some familiarity with her. And so if we have guys who are looking to, and we share that with them at the beginning of the season during the physicals, I sit with each one, I administer a needs assessment. What are some of the things that they're looking to gain from this resource as individuals? And then I will look at it from an aggregate as a team and what the needs are. If they have an individual clinical need, I triage that, and then I'll say I have a list of providers, within the community, Stephanie being one of them, that they can see. And we promote that because we want them to understand too. They can say, hey, Candice is an awesome person. I think she's really great, to be around and to be accessible. But I would prefer to have a clinician outside of this organization just to ensure my confidentiality, which we also promote at the beginning of the year. My interventions look like before game day. So we're in Milwaukee. Our guys have a game day routine where they do some shooting. They will do their treatment on the table. And then those who've elected to work with me, I have 10 minutes. Usually time is limited. And I have 10 minutes and I walk them through a number of different techniques to help them get ready for the game, and not specifically in reference to if they're dealing with anything that is a mental block, but more so that this is a part of their routine. No different than getting the treatment on the table, no different than doing their warm-ups. The mental health aspect or the mental fitness or mental sweat is an aspect of that routine. No different than those other 2 or 3 things that they do pregame. It could be me meeting with them before or after practice. If we're on the road, finding a space to meet with them within the hotel, triaging what it is that they need and understanding, is this something that is ongoing, that needs an hour once a week with a provider? Or is this me being able to do these micro interventions with them, which sometimes is 15 minutes, sometimes might be 30. It never goes beyond 30 minutes. But again, to Brooke's point, I'm adaptable in the sense of what the need is related to the player. So usually that's 10 to 15 minutes given the day and the time. But we do have players who elect to, not just within, one individual team, but it's promoted throughout the NBA that there are providers. And Michael, who's here with the NBPA, they have a provider list. And so that may look like them going once a week to a person physically or by Zoom doing some general mental health counseling. With me, most of my interventions are performance-based. I do use CBT. It may also just be holding a space for them to be able to share so they can get what the experience would be like if they were to go to therapy or do that on a consistent basis. And it's also too being able to educate them on, you do have a need that meets beyond what I'm able to provide for you given my position within the team and given the level of trust that we want to maintain and confidentiality we want to maintain. And so I do have vetted providers that I will refer them to. But most of my interventions are triaging and providing performance-based interventions.
Yeah, and for me, I'm a consultant with both teams, and so in that I typically spend about half a day to a full day once a week with the teams, and then also we'll travel with them typically once a month to a couple of cities. So, and in that, I mean, it's a lot of this job is all about flexibility and right, what do you need, how can you be of service to all of the different folks that you may be working with. And and the other thing too is that I mean, I find like when I'm at a practice, I try to check in with everyone, and so when I'm doing that and talking a little bit with here, no one knows what we're talking about. And so it's like, okay, this is the space that I have to be in, and they're all talking about different things. And so there's also an aspect of then players or coaches see me talking with everyone, and they just see me talking. And so but I've had session, sort of one-on-one sessions with players, sometimes some traditional psychotherapy, but a lot of it is right, like these brief tools. I use quite a bit of CBT and then ACT as well. So ACT has been really useful, I think, within this context. And then if there's some sort of new thing I can try out as well, because there's like these young guys who all play, they love playing video games and so forth. So gamifying some things. So I've started to use like the Oculus and doing some virtual reality work, and even using that for meditation or mindfulness experiences, to even things like reviewing their own film, but using the more intense space of that sort of virtual world. So a lot of fun things. I mean, and then I mean, I'd say we have a great network. I mean, I think, just Candice and Brook are great examples where, we meet monthly with the NBA and the Mind Health program, and we also just learn from each other. So, and we share tips and tools, and that has been so helpful as well.
That's awesome. I love both the creativity that goes along in this work and the adaptability. And maybe that's a segue for, we've got a couple of really great questions in the chat of how you balance basically having to maybe see somebody in the closet or whatever, the adaptability of this, but also the weight, not from a liability standpoint, but especially maybe this combining two questions for you, Brooke. If you have to prescribe a medication and you just did this consultation as you were in an Uber with one of the players, just kind of what goes into your mindset in terms of medication management, how you make that decision, and when the team is hiring you, is that something they're expecting you to do? Well, but hey, don't put all our players on meds, or give them all Adderall. How do you what was the way that you navigated that?
Yeah, I think that the medication, especially ADHD and stimulant, for all the psychiatrists here, is like, it's an absolute must to be able to understand the rules and requirements and regulations that each sport has, and not only each sport, but each league. So I've done, they're called TUEs, or therapeutic use exemptions, for MLB, for NBA, and the ways in which the different leagues do those is so vastly different. So I think just one really big key thing in sports psychiatry is being able to have a really good understanding of the prescribing protocol. And with that comes weighing the confidentiality, because if the league needs to know about it and they're going to fail a drug test, you have to have that discussion with the player, have the ROI signed. So there's so many complicating factors to that, which I find really exciting, and a good kind of challenge in each situation is unique. And then in terms of medication side effects, I'll drop two really good articles in the chat here for the webinar, but there's two really good articles put out. One is by Claudia Reardon, and I'm blanking on who the other one's put out by, but I'll drop it in, on the medication considerations for anxiety and depression in sports psychiatry. And you really have to have a really thorough conversation with the player on risk versus benefit. And both articles really talk about how for mild to moderate symptoms, that CBT and different types of therapy is first line. But then for those moderate to severe symptoms where it's now impacting their daily functioning, then medication is really helpful. And so having a really good understanding and the ability to have that risk benefit discussion with the athlete, and not only with the athlete, but then even potentially the athletic trainer. And really, it's so much collaborative care involved. And you really have to, like Candice talked about, learn how to not only be a good leader, but a good teammate in terms of just the staff and working with staff on different teams. So I'll put those in the chat, but I think those are other reasons why it's so important to have specialized training in sports psychiatry rather than just general psychiatry, because there's so many other factors at play.
It's a good time to have another plug for, I think, the American Board of Sports Psychiatry, which is newly formed, and I think everyone should check out. And maybe speaking of being a good teammate, there's a nice spicy question in the chat that I think could be interesting. There are times where it's been high profile, not great teammates, right? Where maybe one teammate punches a meeting or a teammate in the mouth during practice, and that goes viral on social media. Even Michael Jordan in that big documentary that we all watched during COVID, about him assaulting some of his teammates because he wanted to win so badly. Have you ever been in a position where you almost have to do couples counseling for teammates and say, hey, be nicer to each other or have team chemistry or things like that? Have you been in that sort of role with teams? Maybe it's not necessarily in your team, or just kind of a curious question. Or if you were, like, how you navigate that.
Yeah. I mean, I've had a few situations, over the years. Like we have a meeting that's that sort of includes a number of different folks, including security, like one of the coaches, GM, and there may be players that are engaging in behaviors that are troublesome for the team and may even lead to legal action as well. And it's been interesting. I mean, they have at one point, I mean, I've had folks say like, hey, Alex, you need to go work with them and change what they're doing. And I've been like, I that's not how it works, in a sense. And with that, it's really been some limit setting in a sense, in terms of, these are adults, and we can't necessarily mandate that they're going to see me for something as well. I mean, it gets pretty sticky in those situations. Thankfully, though, I mean, that generally what I've seen happen is when someone is also incredibly disruptive, they eventually get traded. I mean, that's the sort of other thing that happens that's different in, versus sort of in other professions that I've seen. It's like, you're like, the coach doesn't like you, then you may actually be out as well. So that's sort of sometimes the way it's dealt with.
And to add to what Alex said, I remember coming into, well, even during my interview process, when I interviewed in person, came in from an in-person interview, my number one person that I wanted to meet with was the legal counsel, in reference to a lot of questions that I had, particularly in reference to this position, what the expectations were, also what the boundaries and limits would be. And so I was I was proud of myself because I did vocalize that if certain things were to arise, given not only the position itself, the license that I am protecting, I'm also one of few females that work on the basketball operations side of the organization. Here are all the potential worst case scenarios, and what would be the expectation of a person in this role in reference to if there was something that was happening with individuals within not just the team but staff, if there were things that were public that happened with anyone in the staff and or a player on the team, how would the organization navigate that? If there was anything or a grievance that I would have needed to file in terms of people's inappropriateness, in reference to the work that I do, and them understanding what those boundaries are. And so we had that conversation pretty early on in the interview process, and then it was reiterated when I started working here. So I haven't had any experiences where there were physical altercations in reference to my collegiate work or professional work. But, you know, you also have to account for, given that there's so many people that work within the basketball operation side of things, that there's potential for all kinds of different communication breakdowns. You know, you're around people all the time, to Alex's point, more so than you are your family members. And so being able to educate people on not misinterpreting certain things as something that it's not. For instance, I have this rule where I talk to people in my life about, I don't people on Mondays, which means that I'm setting a boundary that I'm at work, and then after a certain time, unless it's an emergency, please do not call me. I'll answer the phone for my clients. But I also educated some of the people on our staff of, like, think about our players. They're so inundated with messages and things being talked about them on the internet, to the point to where they're around us all of the time. And, you know, you may engage with one of them and they may look at you, they may not say hi. There is a such thing as just the mental fatigue of doing this every day. The thought that a person loves what they do every day, even though they're passionate about it and they've been playing it since they were young, like, they are human beings too, and the body can only do so much if it doesn't regenerate itself, if it doesn't recover. These young men aren't getting 6 or 7 hours of sleep. Sometimes we get to, like, we're in Milwaukee, we'll play tomorrow, we'll go right after the game back to Boston, probably get there at 3 or 4 o'clock, with the expectation of practice to get up to play 2 more games back to back. And so, all things considered, it's easy for things to get misinterpreted. And when you're around people all of the time, to where there could potentially be a conflict that arises. And I think within my position, what I've done, um, what I feel like I've done best, is just giving people, educating them on, you know, not necessarily taking things personal. If you don't get a hello and a goodbye from someone, or if there is a rupture within a relationship or a breakdown within the team dynamics, to give it some time for these young men to figure it out before we, as outside individuals, insert ourselves. So my position is typically, if it happens more than once, then let's address it. If it is something that is a part of the dynamic, which, you know, in family systems, things play out, giving them the opportunity and the benefit of the doubt that they can self-regulate. But I haven't had any specific physical situations that I've had to deal with.
Appreciate that so much, Candice, and also appreciate you peopling with us on a Monday here. It's extra. Believe it or not, this is time really was flying by. I know we can have more of this conversation for a long time. Really enjoying just learning from you all. I wanted to make sure to get to probably the most popular question in the chat, and maybe this is a good note for us to part on. It's, you know, if there's folks who are tuning in who are medical students or residents or even early career folks who are just inspired by you, and they want to sort of get their foot in the door, or they want to get sort of on a path to do this work, what would you recommend as far as, you know, small steps, first steps? Should they all just move to where you guys are and follow you around? Just whatever you think would be best. Let us know. Maybe we can start with Brooke.
Sure. I think for psychiatry specifically, there are going to be some unofficial, non-ACGME approved sports psychiatry fellowships here coming up in the next few years, which is going to be really new and exciting. I can think of one likely on the West Coast and 1 to 2 on the East Coast. So just keep a lookout for any unofficial sports psychiatry fellowships. And then in terms of just getting a foot in the door, I think networking with other people that are already doing it, which, you know, we really appreciate you joining this panel today to learn more about it. I think the people I've encountered, they're also excited and passionate about their work with athletes and mental health, that they're always open to, and myself included, to speaking with people who are interested. And then through the American Board of Sports and Performance Psychiatry, we do offer mentorship as a part of the Pathway C, we call it, which is if you're a general board certified psychiatrist wanting to do sports psychiatry. And we have some really, really big names, which I know Candice and Alex are familiar with. Dr. Victor Schwartz, he's one of our mentors on the mentorship committee, as well as Dr. David McDuff, who's been doing sports psychiatry for the Orioles for over 25 years. So we have a lot of really fantastic people ready in the wings, ready to help once that educational path rolls out in around September. And then for people that have already been doing it for a while, there's Pathway A. And for people that have already completed the ISSP certificate or the ISC mental health diploma, you can apply through Pathway B.
Awesome. Thank you, Brooke. Candice or Alex?
I would say think of mental health as multidisciplinary, in the sense that there are so many different organizations outside of all of our respective credentials and training that are focusing on the mental health and wellness of athletes that are also inviting of other disciplinary respective credentials in terms of being able to join. So ASWIS, which is the Association of Social Workers in Sports, AASP, Association of Applied Sports Psychology. I know APA has a Division 47 on, I think, exercise and sports psychology. And so those are all ways where there are clinicians and individuals like myself who are members of those organizations, and it affords for an opportunity to network, but also to be a part of different committees, to get to know different individuals within the space. USOPC, I know, has a sports medicine, I believe, conference that they have every year as well. In addition to the NBPA had a, and I know Michael is on this, on the Zoom, they had a sport mental health summit. And then most recently, I can't think of his name, but he works with the Arizona Diamondbacks as their mental performance coach. They did a pilot this past year, which I think will probably go more public in the coming years, of where they invited different clinicians within different spaces to be a part of that, to get some training. So I would encourage each and every one of you, if there is a conference, if there is a summit, if there is something that is offering continuing education credit in reference to sport. And then Rutgers University does have their CEU, their continuing education, where they have some stuff that's on demand. And then every now and then they'll do a live webinar where you can pay a fee in terms of just the education and being able to be in the room with those individuals. And I also think, networking is a big piece of it. I also think how you approach people who are in this space in the most professional way possible leads for an opportunity for collaboration. Oftentimes, and I don't want to speak for Brooke and Alex, but I know they probably get this. So many people reach out in reference to connection and wanting to learn more, and being a little bit more strategic in what it is that you envision yourself doing, how you can be helpful, because we're always looking for people to connect with who are doing really great work. And so I would say those two things, networking, but really being able to immerse yourself in anything that is happening within the sports world, where they are talking about holistic health, a continuity of care in reference to mental health and sports medicine within the different respective leagues and sports.
Yeah, great thoughts. And I would add, from my, sort of my experiences, I think, I think about who are the medical professionals that are required to be on teams. And it's typically, primary care and then orthopedics. And then, of course, the trainers, and those being, PTs or, certified athletic trainers. And so going to some of their conferences for example, like, and their conference is like one of the big ones, especially within sports medicine, is the American Medical Society for Sports Medicine. So that is a huge conference that many providers who work with athletes attend, and they provide talks. And, with that, they don't typically know a lot of psychiatrists or psychologists, especially in the ortho world. And so I think those are good people to also, those might be good people to connect with, to try to get your foot in the door a little bit as well, because I've found this, it's a pretty small world in terms of, at least within like the NBA and, now MLS as well. And so in that, though, I think those are some of the good ways, the networking, and then some of those educational opportunities as well that were discussed.
I love that. I just want to take a moment to thank you. I know Brooke had to sign off because she has a patient, ironically, of course, like right now, to be able to see them on the West Coast. But I want to get you all out of here on this, and I just want to first take a moment to really thank you, Candice and Alex, for the really expanding our minds, I think, both from an interdisciplinary approach, thinking about this in a bigger picture, and kind of hearing from your experience and seeing the work that you do has been really inspiring for me. So I'm really grateful that that you all took this time on a random Monday and a very busy sports weekend. And I would be remiss if I don't ask you for this one last parting question of, we need a little bit of a championship prediction for the NBA. I know we've got the best record in the East and the defending champ, but who's got it tonight for the NCAA game, and who's got it for the championship? And if you say the Knicks to both answers, it's totally correct. That's the only correct answer, but feel free to say other things. That's totally okay.
Well, yeah, I mean, it's going to be, tonight. I was reading an article about, men's UConn, and and I didn't realize that Bill Murray's son is the assistant coach as well. And so that was really interesting. So now I'm, definitely pulling for UConn. Well, I'm hoping it's I'm predicting it is a, Nuggets Celtics final. So, because I want to go hang with Candice and in Boston, and then when you come out here, I'll take you out for good, we'll get some good grub, and yeah, it'll be Nuggets in Game 7.
I like it. All right. 7, I got you. Okay. Candice, what do you think?
I'll say UConn in terms of tonight's game. Men's basketball, gotta rep the now home team. And then to Alex's point, Denver and the Boston Celtics. It has been the awesome part about, that would be like, I reached out to Alex last year because I was new to this, and he was so helpful in giving me some nuggets, pun intended, on how to navigate this world and be successful. And so not only would it be, a battle to the championship, but also we'd get to hang and be able to support those guys as they, duke it out. But I would say all the way to Game 7.
Appreciate that. Look at that camaraderie. Just a beautiful thing to see among all of us here. Well, thank you again so much thank you to the panelists. Thank you for those who were joining us. Wonderful questions, really, really great. And as you saw, there were really helpful links that were dropped in the chat. This was recorded, so we're also going to be sharing the recording, and just have a great time tonight watching the game. And thank you for all the work that you do, both with athletes as well as for the patients that you're seeing. Thank you, Jose, and have a wonderful evening. Thank you, everyone.
Thank you, everyone.
Yeah, thank you. Thanks so much for the opportunity.
Thank you for being here.